There are a lot of questions about whether you can catch the coronavirus a second time. And as Local 12's chief investigative reporter Duane discovered, the answer to immunity isn't so simple.
Right now, the biggest strategy to stopping COVID-19 is to avoid it. But as we go back to working out in public again, we're increasingly relying on tests to find out who already had it. That's because many of us believe if you've already caught the coronavirus, you're not going to catch it again. On April 24th, the World Health Organization, or WHO, issued this warning, declaring there is currently no evidence that people who have recovered from COVID-19 and have antibodies are protected from a second infection. That sent shockwaves to people everywhere who were in part counting on immunity to get back to normal. The WHO's warning was technically right because there simply isn't enough scientific evidence about immunity to COVID-19, a virus that surfaced only 5 months ago. Still, most medical experts believe those who beat COVID-19 do develop some immunity to it. To gain immunity, you must produce antibodies, proteins in your blood that fight off the virus. And in this report, the Icahn School of Medicine at Mount Sinai in New York studied hundreds of COVID-19 patients, finding all but 3 did develop antibodies, and that 511 of 624 patients were strongly antibody positive on the first test. That's 82%. A good sign they had developed immunity. The team concluded almost all participants mounted an immune response to this disease. Other smaller studies like this one from China back that up. But none of the studies can say how long that immune response will last. So scientists are looking at related coronaviruses, like the common cold, for answers. A study released 3 decades ago revealed a strain of coronavirus that triggers a cold produced enough antibodies to fight it off again. Of 15 volunteers who were reinfected with the same strain a year later, the researchers found none developed a cold. Studies of other more deadly coronavirus strains reveal the body produces enough antibodies to provide immunity even longer, up to 2 years for severe acute respiratory syndrome, or SARS, and at least 34 months for Middle East respiratory syndrome, or MERS. So the studies indicate there is an immune response to COVID-19, but the research reveals just as clearly that immunity doesn't last forever. So if you think you can't catch the coronavirus again, unless a vaccine is developed soon, you're wrong. I'm Duane.